Good evening.
Good evening.
Thank you.
Hello, good evening.
Good evening.
Lovely to see you.
Lovely to see you too. Well, or not.
Fantastic. Well, this week we're doing discussing the gut as a second brain, and this is a topic we were going to do last week, but unfortunately we had to postpone. And yes, so we'll get started.
Let's go for it.
So we'll start off with, if you could explain to us where the brain actually is.
It's a good question. In general or now? Okay. So it's very interesting. You know, as a clinician, I'm always fascinated how we try to position always or localize something somewhere, right? Like, and then we probably will start treating it. So, for example, no, we must think just right now. I was speaking with Elizabeth, mentioning to her some cases like of pancreas, no, that I can see that a lot of people have got like low pancreatic enzymes, but they have no idea, and so they kind of go and do some treatments for their lower back pain, but actually, as a matter of fact, that's the lack of some pancreatic enzymes. And so, you know, with this example, I'm just trying to say that it's not always as simple as saying, okay, so this is where the brain is located, and this is the problem with the brain. Okay, so our brain actually starts. Our brain is obviously here in our head, and we know that it's composed of different tissues. A lot of them are nervous tissues related to neuroglia, okay, the neuronal tissues, obviously neurons, and gray matter, white matter, and so on. You know, I'm not going to go into the composition of the brain, obviously. And then we also have the brain, and the brain is obviously 60% fat. Okay, so when we are literally speaking about the lubricating the brain, the importance of all those good fats like DHA, for example, that you know, our body really does not cannot produce, and so we do need to eat some oily fish, for example, right? Sardines or mackerel, for example, very important, so that they're not produced in piscifactory, but you buy them. Small fish, and this is not you know, dirty fish, so not toxic, so that's important. Just make sure you don't eat them every day, so you don't develop some intolerances or allergies. Okay, and so that's our brain. But very often we also speak about the second brain, and so where it actually all coming from, you know, where how do we end up having the signals in our brain? I mean, do they just come from some outer space? Okay, so it is not so. So our gut is really multifunctional, and we are the system. Okay, we are this absolutely fantastic system where basically this hardware, and every one of us is wired in an incredible way. And so 80% of our immune system resides actually in our gut. But apart from that, our gut, our small intestine, therefore I'm referring mostly to, is contains own nervous system. Okay, so, and this nervous system is called enteric nervous system. Okay, it's an incredible system that actually is able, when we are nervous, to shut down the gut. So this is why when we get nervous, when we get anxious, sometimes just like this cramps, and you feel, oh my God, you know, I really don't feel like eating anything, I lost appetite. my gut seemed to be so closed, and so this is actually the shutdown of the gut, the enteric nervous system. You have gone into fight or flight, okay? And this enteric nervous system is called the second brain, okay? And there is, we are perfectly wired if we want to maintain ourselves in optimal health and just read the messages that our body is sending us. Sometimes just very subtle messages that it's very difficult to recognize sometimes, but we have got something that's called vagus nerve. It's a tense cranial nerve, and it runs all the way from our brain and through our esophagus, specifically through our digestive system, through our heart. It's basically transmits the signals backwards and forwards, okay, in our system, and it's responsible for the digestion, and it's able to also interact with enteric nervous system. So this is another reason why our gut is called the second brain, because it is actually the gut that via vagus nerve able to signal back to the brain. It is never the brain signaling back to the gut. It is gut signaling back to the brain. And one of the reasons for it is because our gut produces the neurotransmitters, okay? Now, it is hugely fascinating just to know that neurotransmitters, again, something that we are told, okay, this is just the neurotransmitters that are serving us to be joyful or to be nervous, or I've got a little bit of, a little bit too much of excitatory neurotransmitters or inhibitory. So, people are put on the, dopamine suppressors or SSRIs or MAOs and so forth. And so, basically packing up their receptors for the neurotransmitters and so on. But actually there is an imbalance there, and we have to look at our microbiome. And so this is why our brain is, our second brain is in our gut, because of this, constant production for supply to signal back to our brain, okay?
Yeah. And we were talking earlier, just before coming online, about, and if you could expand, because I found it very interesting, about this idea of the brain on fire.
Yeah,
you mentioned earlier.
So so brain on fire. Basically, we so far, up until quite recent, okay, it's been thought that the brain is quite an isolated event. I would call the brain not the organ, but an event, okay? So it's totally protected. There is a blood-brain barrier, and this barrier is constantly, it's absolutely intact, okay? So the neurons do not regenerate. So once there is something wrong with the neurons, or there's been a hypoxia event, for example, this is to say, for example, the heart attack or some ischemic attack, so the brain is actually starved of oxygen, the neurons die, the person would never recover, and so forth, okay? And so there is a blood-brain barrier, and so whatever we do, nothing can get through to the brain, okay? There is no supplements, nothing. It's just a completely different, separate entity. And now we know in functional medicine, when we do the systemic approach and where we're really connecting the system, and here I really would like to mention and give a huge tribute to my colleague and my boss at the moment in Apollo Health, Dr. Dale Bredesen, with whom I closely work with him and his team in Apollo Health on as a clinician on treating people and creating the protocols and treatments and experimenting with them and applying them in clinical practice for those who have cognitive decline, who have dementia, who have Parkinson's. A year and a half ago, we published a scientific paper that documented 250 cases of reversal of cognitive decline, okay? this is very important work. It is very tedious work, and it's basically demonstrating and proving through being able to heal and improve and positively maintain the brain. Again, I'm not going to go into the details of the brain, okay? But this is, every time I talk about the brain or the second brain, the gut, or, you know, the connections of the gut and the brain, I always honor my team at Apollo Health, Dr. Dale Bredesen. You can find him very easily in YouTube. I have trained as a clinician with the Bach Institute for Research on Aging in Novato in California back in 2016. And so since then, slowly but rightly, we have been developing our research and our work in applying that. And so, yeah, this is sort of, yeah, why was I saying this? What was the question?
We were about the brain on fire.
The brain on fire, yeah. And so the brain, I know that mine is probably not, because I remember that I was speaking about the blood-brain barrier, okay? So it was an isolated event that was thought, but it is not, okay? Because when we start having a problem with our gut, okay, and there is something that is called a leaky gut, okay, it's a permeable gut. So basically the mucosa gets attacked and it starts thinning, and then the viruses, bacteria, fungi, you know, parasites and toxins that are divided by this thick mucosa, mucosal membrane. You know, the mucosa is thinning, and they just go through and they attack the wall of the gut and end up in the bloodstream, and then the blood issues tugs and you know, starts issuing antibodies basically. And when the blood issues the antibodies, okay, it's to maintain its own very tight alkaline pH. If not, people may get sepsis, for example, or septicemia. So in this case, if there are when the systemic inflammation or systemic consumption of something, for example, some food, yeah, or some environmental exposure is really systemic, and we are not paying attention, you know, maybe to some signs our body gives us. In this case, this autoimmunity, okay, these antibodies, they can start attacking our own tissues. And one of them is indeed the brain. Okay, and so the blood-brain barrier can be also thinning, and they can actually degrade the blood-brain barrier. And these days, for sure, like when we do some Cyrex, for example, testing for the blood-brain barrier, and just seeing some tau proteins and you know, folding proteins, C-nucleins, and so forth, we really very clearly see how the brain gets attacked, and then the proteins start folding, okay? As you probably know, maybe from the chemistry, the proteins are always very straight structures, yeah? And so when they start folding like spirals, okay, they're not able to transmit the messages properly, so to say, okay? And anything that folds or create plugs, you know, which is ultimately another problem that brain would do when the blood-brain barrier is broken, because there is a broken gut, okay, should it attack the brain, then you know, it's really the immune system trying to defend the brain. So we may develop the brain fog, for example, the problem with the concentration, the problem with the memory, or start getting very tired. Now, remember that you know, brain is a very demanding metabolically organ, okay? Just like, for example, our heart is, or our liver is, but the brain actually consumes about 25% of the whole energy output daily. So it's quite an intensive work that brain does. So we really need to, you know, not just treat the brain fog or migraines or headaches or any really lack of you know, cognitive or executive functions, for example, as a well, I'm just going to take the pill. Go back to the gut. I really suggest go back to the gut. There is some very outstanding things that can be done these days, and I really see how much people improve, in all senses. People who have problems with memory or cognition, or even people who have cancers of all sorts. I've treated people with ependymoma, 2 children, when nobody would take them into the clinic because of the growth hormone, or people with breast cancers also, because let's not forget that everything is about the immunity being triggered, and also the receptor sites and so on. So this is really important, or any type of any other cancer, for example. So it's about understanding what is the priority in the treatment, for example. So I would really recommend to always go back to the gut. And one thing is, please just don't go back to the gut, and start taking the probiotics, okay? Because this will not be the right course of action, okay? And maybe later, if we have time, I will explain why.
Oh yes, so we can discuss the supplements later. Now, did you want to add anything else about the brain and the relationship between the gut and the brain, and maybe science? So you said like brain fog.
Yeah. So for example, there are some symptoms that. And obviously here today I'm just focusing on the brain, okay, the blood-brain connection. But ultimately, and I would mention this, okay, because I also collaborate in a dispensary just to get myself out of my clinical practice and be more with people out there on the street, to see how people are treating themselves and what they take. And I see that people go for probiotics very often, and also just to remind everyone, when there is a joint pain, when there is some lupus, rosacea, when there is osteoporosis, for example, when there is rheumatoid arthritis, just remember that these are autoimmune, thyroid, okay, that these are autoimmune conditions, that somehow, somewhere, the immune system is getting really overreactive, and somehow, somewhere, it's attacking those tissues. And it can also attack organs. We have never seen so many people at the age of 45 and 50 having diabetes type 1 when they stop producing the insulin. Okay, so now back, I just had to say this, okay, because I think very often we are looking for the pill to treat our osteoporosis or joint pain, and a little bit redness here or there, the hormonal dysregulation, and we're just forgetting, we have to get back to the basics all the time. And now I'm going to go back to the brain, okay? So when we speak to the brain, when we speak about the brain and gut connection, so Elizabeth has quite rightly said, so what are other symptoms? And, it's very interesting because, and in a way we cannot be blamed for not, relating things, okay, because what I'm just about to say, it's very curious, because we feel the pain, okay, and I can say that maybe epigenetically, or maybe because how our receptors, because everybody's in everything in the body is by the receptors, we can feel more pain, we can feel less pain, and so on. That's why partially some people take, for example, low dose naltrexone, or cannabis, small dosage every day, just to fill up those receptors. But yeah, this is how our body is really, working.
Okay. And if we do feel like maybe that's something, can you suggest supplements that are possible? I mean, I know it's, again, very difficult to suggest supplementation because it's so individual, but yeah.
So I just will finish the last thing that, I don't think that I answered the full question. So, so back to what other symptoms could be, okay, and how and why we don't relate them. Basically, it's because the person could be very clingy, or the person could be crying, or the person could be sort of, you know, just complaining, or being very tired, or being really, you know, in a bad mood, or being snappy, for example, okay? And you say, yeah, but, you know, no complaints about the gut. You know, there's or some people that we see, and I know that I should be looking into the gut and I will find something there, and I know what I should be looking for. But people say, no, but I never have anything. And this is because our gut, you know, everything in our body is about protection, and our gut is covered by this absolutely fantastic, marvelous armor, okay? And this is a shield, and this is the mucosa, okay? And there are fibers in this mucosa, okay? And they don't have pain receptors. Okay, so the only way that you will be experimenting if it's the pain, it's when you are maybe just progressing to the next stage and you start really, you know, you have some perforation in the gastrointestinal wall, for example, or you know, there is a stomach ulcer or some colitis, for example. There is a really, you know, very, very thin mucosa, or erosion of mucosa, or erosion of villi, for example, or very low serotonin, or you know, and there is no motility, so you are not going to the bathroom properly, because imagine neurotransmitters, they participate in motility. So a low serotonin doesn't mean that you're just like, oh, okay, I'm always a little bit depressed. Okay, it actually also your gut motility would suffer. But yes, do pay attention to people who would like to cry, people who get tired, people who get snappy, get in a bad mood, you know, and they are fine. Okay, so this is why so many things are symptomatic. Eventually something will show, but because most of the time, and ideally, we would like to really practice prevention. Okay, and this is very important. Yeah.
Okay, great. Thank you. That's interesting. So I guess then we have to look after our gut, and then mucosa
Yes.
would be. So in what ways can we do that?
I think what has been very successful. Okay, it's also obviously everything is individualized, and I would suggest that the good stool test definitely has been very, very, very revealing, because it's not about taking probiotics. Okay, it's not. It's not about just going for L-glutamine. No, it's not. Okay, how do you actually recondition? How do you heal? And everybody is really an individual case. And so my basic suggestion will be is definitely have a look with the stool test, if you can, through your gut mucosa. Okay, gut mucosa, no, the gut microbiome, the gut dysbiosis, that means the balance of your bacteria, and the inflammatory markers. Okay, by inflammatory markers, I mean, you know, good clinician would always look at zonulin and oculin. Those are actually the proteins that sustain the tight junction in your gut. Okay, so that your gut is really very, very tight. Nothing, it's not open like this, it's tight. So there is nothing that goes from the enemy side, where we have our fungi, viruses, pathogenic bacteria, and it goes through, okay, through, and attacks the gastrointestinal wall. Okay, so that is something very important. In these days, I would really suggest that you know, it would be much better if we are not just testing for the presence of zonulin or oculin, but we're actually testing for the antibodies. Okay, those tests are good. Lipopolysaccharides, that's something that we're also looking for gram-negative bacteria. I'm just giving this information in case somebody, some of you may would like to know just a little bit more technical information. Once again, very often we're not just looking for the presence of lipopolysaccharides, but we're actually looking for the antibodies, okay? That means, why do we look for antibodies? Remember I said that the mucus got very thin, and the mucous membrane, it's our first line of defense, okay? And so when it gets too thin, that all these fungi, bacteria, viruses, pathogens, parasites, toxins will go through and attack the wall and then go into the bloodstream, okay? And so amongst them, there will be zonulin and oculin, because they are, you know, these proteins cannot be in the bloodstream, so they will be tagged and there will be an antibody against them. So, you know, this is why it really is very important to pay attention to that. And we were speaking about the supplements.
Yeah.
So in terms of supplements, it's omega-7. I would really recommend the sea buxom dairy oil. Omega-7, it's really is amazing. It's a beta carotene basically, and it's amazing in producing and generating the mucosa. Okay, you can take you know, just take 1,000 milligrams a day, for example, but if you would like to take more with clinician supervision, that's really always good. Take L-glutamine, take Sera enzyme, for example. This is really amazing and good for getting down the inflammation, okay? And literally serapeptidase, that eats up the inflammation, so it really gets and works on those pro-inflammatory cytokines. It's very important to get down the inflammation first, okay? Because when the inflammation is up, it's very difficult to actually calm down any tissues, okay? So, or treat anything, because the inflammation is very, very aggressive. And I would also suggest for a good clinician, you know, it will check for interleukin-6, for example, for TNF, alpha, TGF-beta, for example. Those are the markers that I usually would check way above the C-reactive protein, the antibody to parietal cells also, and so forth. So really great focus in the gut. I would also suggest maybe you know, to take some betaine, for example. Betaine is really always very good, just to help to regulate the hydrochloric acid in the stomach, okay, as a first line of defense also. And we know that betaine is also very important for creating the macrophage factor for the immune system, and works perfectly and beautifully in conjunction with prohormone D. Everybody knows vitamin D, but vitamin D is actually a hormone, okay? And so, yeah, I also would suggest maybe taking the L-threonate, L-cysteine. A very beautiful supplement is Baikal Skull Cup, just working on the inflammation. And I have very good results. I see very good results in clinic with the tinctures. I like them really very much. Marshmallow root, for example, or golden seal, you know, really very beautiful healing there. Yeah, and also some spore bacteria, okay? So don't just take the bifidobacteria or lactobacteria, but just work on the small colonies, okay? Potentiate some bacterial colonies that help to create mucosa. Remember, mucosa is the first line of defense, okay? And this is what is gonna safeguard your brain also, amongst other things. So work on those tiny, tiny colonies, okay? Because if you are just taking the same probiotic all the time, okay, it's just going to displace all others, okay? We cannot take stuff long term. Everything has to be rotational, and it has to be clearly justified, okay? We have to really understand what we are doing. It's hugely, hugely important. I also suggest this for people to measure their immunoglobulins, just the total ones, okay? Immunoglobulin G and M and E, for example, and A, of course, and just to see how they're doing. You know, is there anything wrong with them or not? Some people prefer to do the test that's called ANA. It's anti-nuclear antibodies just before going to immunoglobulins, that's also fine, because usually it will show something in ANA if something is seriously out of balance. And just remember also that anything that is thyroid, for example, anything, it also, thyroid relates to the brain, okay? And if we do have something wrong with our thyroid, for example, okay, we can take our medication for the thyroid, and medication could go up, for example, just to help us to maintain whatever there is it's wrong with the thyroid, whether it's TSH or whether it's the T4. But just remember that usually it would be attacked tissue, okay? Something would be wrong, and it would be really autoimmune. Thyroid issues usually are all related to the autoimmunity, to the stress, to the adrenal stress, and this is why very often we talk about the thyroid adrenal axis, for example. So just work on your stress. Always go backwards, okay? Go backwards to the root cause, and this is really crucial. The reason why I'm mentioning the thyroid is because, obviously it can cause anxiety, it can cause extreme fatigue, and so, yeah, very important. And another thing is, I would mention as a supplement, it would be the B12, okay? I suggest taking B12 not necessarily in methylated form, but as hydroxy or adenosine, because I find it much more tolerated format, okay? Basically, B12 needs intrinsic factor in the small intestine in order to be able to get absorbed. And a lot of people with the leaky gut or gut permeability, for example, they're really lacking this intrinsic factor, okay? And so, which can be measured by the antibodies to parietal cells. And so, therefore, the B12 cannot be well absorbed, okay? Or, take that form of B12, for example, and if you can take it in liposomal format, for example, or through sublingual oral mucosa, for example, to get absorbed, that would be great. And one of the last things I would like to mention, obviously, is the oral microbiome, okay? The oral microbiome, obviously related both to the gut, and also it relates to the brain, because very often people would have bleeding gums, or they would have gingivitis or periodontitis, inflammation or receding gums, and so on. And so this is all related to the bacteria in the mouth, okay? There is an imbalance of bacteria. And remember, we're never trying to kill anybody, okay? Be it the bacteria, be it viruses, the fungi, we just want them go back to their side, and we want to recreate and recondition our gut, and we want to grow the mucosa. And so, yeah, just very, 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 very important. And one of the things that, I would like to say is always look at your stool, okay? If you do have some mucosa in your stool, that means that you are shedding mucosa, okay? So that is not good. Develop relationship with your stool, it's part of you, literally speaking, it's your shit. So, and we really have to get to know it. It's that important. So, yeah, I think that's basically, yeah, without naming too many supplements, this would be really the good initial recommendation. And if you can, always work with the practitioner. If you can, always go to testing. You can even contrast, for example, testing your gut and testing the neurotransmitters. Neurotransmitters, we find it very useful to test in urine, so they are all non-invasive testing, okay? This is beautiful testing, be it urine testing or, organic acid test, for example, which is again urine test, because, the body at the end of the day, everything is metabolized in the body, and we want to know what organic acids we are having at the level of neurotransmission, of mitochondria, of the gastrointestinal absorption markers, inflammation, and so on. And this is just a very very beautiful way. It really is the testing that is available today for the medicine of the future, you know, that is already being practiced these days, okay? And just, I want to say, never be afraid, because there is, when there is a root cause, and if you can't go there, okay, just go there, okay? If you miss the bus, okay, you can always wait for the next one. It will come. And the same here. In health, we have many, many opportunities. We have to be believers, okay? Believers in that we can heal, and we really can.
That's such a lovely note to actually finish on this evening. Thank you so much. And thank you all for joining us. Unfortunately, I don't think, I mean, if anyone has a quick question, but we're almost at finishing time. So I don't know.
Any questions, anyone?
Any questions? 'Cause we're about to, it might cut out.
Any questions? No?
No? All right, well, thank you very much for joining us this evening, and yeah, I hope you enjoyed it, or we hope you enjoyed it, and we'll see you next week if you can join us.
Yes, that would be great. And so just remember that, keep posting us your wishes, what you would like to hear. You know, basically we are trying to convey very complex information in a very simple language, and our aim is educational. You know, that you are your own doctor. You have to understand what lifestyle changes you need to make, and what supplements you need to take, and so on. By the way, I would mention one thing, okay, and it's a neuroinflammation. Gluten is toxic, okay? So please don't take gluten, okay? Take it out of your diet. It's not glutinous per se, but it's a gliadin, it's a protein in the gluten. So without further ado, without going into any more detail in this talk, just take a really, really, really good care, okay? Soy, also tomatoes, aubergines, some nightshades, just take really, really good care. And watch out what you're reacting. If you've got some rashes, you know, maybe if you get nervous after eating something, or a couple of days later, because reactions are after eating not always immediate, okay? So just remember and observe yourself, okay? Observe yourself. It could be some histamine, and histamine, it's not just like taking antihistaminics, okay?